Hi, my name's Kirsten Eagles. My student number is T00698082. Today I'm going to be going over the muscular system. So here I have my dog Molly. She's going to be my demonstration today, and I have Kim helping me out. So first we're going to start with the extrinsic muscles of the thoracic limb. Alright, so we're going to start with the extrinsic muscles of the thoracic limb. So first we have the superficial pectoral muscles. So they are on the chest. So it's actually a group of two muscles. They come out from the sternum and go to the inner sides of the humerus here, and then down on the ventral side of the chest there as well. And we have the deep pectoral muscles. So they are on the sternum. So if we get Molly just to stand up a little bit. So we have them right down around here. So both of those muscles help to abduct the limb, so by moving the limbs inward towards midline. And then the deep pectoral muscles helps to pull the limb caudally, so it pulls the limb this way. Then we have the brachiocephalicus muscles, so that's actually two muscles. So first we have the cladobrachialis. So that one here is on the, so it starts at the clavicular intersection and actually goes down to the cranial humerus on either side. And that helps to pull the limb forward, help to extend the shoulder as well. Then we have the cladocephalicus. So that starts as well at the clavicular intersection, and that goes up this way to the temporal bone. That also helps to pull the limb forward and to also help to extend the shoulder. Then we have the trapezius. So that is along the dorsal aspect of the neck here. So it's a longer muscle that starts this way and then comes down to the spine of the scapula, and that helps to advance the leg or move the leg forward. And then we have the rhomboideus. So that starts at the occipital bone here and actually lies underneath the trapezius muscle. And that helps to elevate and then abduct the limb as well. So if we elevate the limb and then abduct or move away from the body. All right, next we have the latissimus dorsi. So that's a large muscle that actually sits right along here, comes up towards the to the vertebrae. So it starts at around the 7th thoracic vertebrae, and then the spinous processes of the lumbar vertebrae as well. So that helps to draw the limb caudally, and then also flexes that shoulder joint. Then we have the serratus ventralis. So that helps to support the trunk. So it's a muscle deep within here, and it starts at the cervical vertebrae and the ribs. And this, again, helps to support the trunk, so just keep this part stable. Okay. All right, so next we're going to go over the muscles of mastication, or the muscles for eating and chewing. So first we'll locate the parotid and the parotid lymph node, and then the mandibular salivary glands, and then the mandibular subaxillary lymph nodes. So they are right in here, and then from there we can find the muscles of the head. So we have the sternocephalicus. So that actually starts right here at the sternum, and it helps form that jugular groove right in here. And that helps to move the head from side to side. So if we look this way, this way, girl. And then we have the muscles of mastication, so for chewing and for eating. So the first one is the temporalis muscle. So the temporalis muscle is actually one of the larger muscles. So it comes all the way, so it's right up here, and it actually comes all the way down to the coronoid process of the mandible. And that helps to close the mouth while chewing. So if we're chewing, here we go, you have that muscle working here. Then we have the masseter muscle. So that's the muscles that are actually right in the cheeks. So right in here, you have those two large muscles, and they help with elevating the mandible and closing the mouth while chewing. They're one of the strongest muscles of the head. Then we have the digistrictus. So that is along the underside of the head here. So it starts at the occipital and the temporal bones and goes along the ventral mandible, and that helps to open the mouth. And then we have the myohyoides, so that is actually right underneath the jaw here. So it's a little sling of muscles for the tongue, and that helps to raise the floor of the mouth. Okay, so next we're going to go over the intrinsic muscles of the thoracic limb. So we'll start with locating the prescapular lymph nodes. So they are right in underneath the scapula, right in here. So first we'll go with the deltoideus muscle. So the deltoideus muscle starts along the spine of the scapula. It actually has two muscles that kind of come and meet right in here. And what that does, it helps to flex the shoulder, so to bring the shoulder upwards this way. From there, we have the infraspinatus muscle, so that actually lays underneath the deltoid muscle. So it is along the scapula, so along the infraspinatus fossa of the scapula. That helps to flex the shoulder and then to help to abduct the limb. And then the supraspinatus is on the opposite side of that, opposite side of the spine of the scapula, in that supraspinatus fossa. And that also helps to extend the shoulder. Extend the shoulder that way. We have the subscapularis muscle. So that is on the inside of the scapula, so on the medial aspect of the scapula. That covers that part there. And so that helps to adduct the limb, move the limb in. It also helps to rotate the forearm medially. We rotate it there. Then we have the teres major. So that is along the caudal border of the scapula there. We feel right along here. Scapula, right in there. And that helps to flex the shoulder as well. We flex that shoulder up. That. We have the biceps brachii. So that is the large muscles right in here. So they help to flex the elbow and extend the shoulder. So if we have the elbow here, we'll flex that elbow, feel that right in there, and then extend the shoulder. This way. Then the brachialis muscle. So the brachialis muscle is along the cranial part of the humerus there. And that as well helps to flex the elbow. That right in there. And then the triceps brachii. So they're on the inside, the medial surface, and then along the caudal surface of the leg, or the humerus as well. And that helps to extend the elbow and then helps to flex the shoulder. Up in there. All right, so lastly with the forelimb, we're going to talk about the digital flexors and extensors. So they all lay in along the radius and the ulna here. So the flexors help to flex the carpus and to flex the digits. And then the extensors help to flex or to extend the carpus and extend the digits. All right, so next we're going to go over the pelvic limb. So first we'll find the popliteal lymph node, which is right around back here. So we'll start with the tensor fasciae latae. So that is a group of two muscles that kind of sit right up in here. And what they do is they help to flex the hip up, and to extend the stifle as well. Then we have the gluteals. So the gluteals is actually a group of three muscles. So first we have the superficial gluteal. So where that sits is it's kind of back here, right along there. Molly doesn't have great muscles back here, so it's kind of hard to feel them. And then we have the middle gluteal. So it's like an egg-shaped muscle that sits right along up here. And then we have the deep gluteal. So the middle gluteal actually covers the entire deep gluteal, so it's underneath that. So what all of those help to do is help to abduct the limb, so move the limb away from the body, and then extend that hip as well. Extend it. Okay, so next we have the biceps femoris. So they're actually the largest muscle within the leg. So they cover most of the lateral surface of the leg, and then the cranial part too. It actually covers down to 3 joints. So it helps to extend the hip, we extend the hip, it helps to flex the stifle, and it helps to extend the tarsus joint. So it's a pretty important muscle. Then we have the semitendinous and the semimembranous muscles. So if we turn Molly this way a little bit. So the semitendinous is a strip of muscle that comes right along down in here. So the semitendinous helps to extend the hip. So extend the hip, flex the stifle, and then extend the tarsus. The semimembranous is right along and beside that. So that muscle there helps to extend the hip. All right, so next we have the sartorius muscle. So that is a strip of muscle that kind of starts in medially here and then comes outwards. So that helps to flex the hip and then to help extend the stifle. And there. We have the gracilis muscle. So that's a large muscle along the medial aspect of the leg, right in there. So what that does, it helps to adduct the limbs, move the limb inwards, it flexes the stifle, and then extends the hip and the hock. Then we have the pectineus muscle. So that is a small spindle-like muscle on the medial aspect of the leg, right in here. What that does, that helps to adduct the limb as well and move the limb in medial. Then we have the quadriceps femoris muscle. So that is, it's actually a group of 4 muscles all together, and they all kind of work right around this area right here. And that helps to, again, extend that stifle and to flex that hip. And then lastly, we have the gastrocnemius muscle. So that is what would be equivalent to like our calf muscle. So that helps to extend the tarsus, and it helps to flex the stifle. So I forgot to mention while doing the video to talk about the extensors and the flexors of the pelvic limb. So where they lie along the lower leg, along the tibia and the tarsus there. So what they do is to help flex the lower limb and flex the digits. If you close them in there, and then they help to extend the lower limb and extend those digits. All right, so next we are going to go over the muscles of the abdomen. So first we will start with the external abdominal obliques. So they cover a large area of the abdomen. These next few muscles, they're actually all layered over top of each other. So you have on the outside the external obliques there. Underneath those you have the internal abdominal obliques. So they kind of run along in here, and they all meet at the linea alba here in the middle. Then we have the transverse abdominis muscle. So that is along the sides, right in here. And then we have the rectus abdominis, which is 2 strips of muscle that run all the way from the sternum down to the pelvis. So what all those muscles do, all of them help with different body functions, such as like urination, defecation, vomiting, anything that requires pressure from the abdomen to happen. It also helps with movement of the abdomen as well. All right, so lastly we have the muscles of respiration. So first we have the serratus dorsalis cranialis. So that is a group of muscles that sits right along the ribs themselves. What they do is they help to lift the ribs for inspiration, so it increases that thoracic space to allow the lungs to expand. Then we have the serratus dorsalis caudalis. So they sit along the lower ribs there, and what they do is they actually pull the ribs caudally to help decrease that thoracic space and for expiration and squeeze on the lungs. Then we have the intercostal muscles. So first you have the external intercostals. So they're all along the internal, or the spaces in between the ribs, and they actually wrap around the ribs as well. So the externals, what they are for, they're the inspiratory muscles. So they twist the ribs to allow them to expand, and they are the more superficial muscles as well. So they're used for inspiration for pulling the chest open. Then we have the internal intercostals, which are underneath the external intercostals. So what they do is they twist the ribs to help contract the thoracic wall. So they're the expiratory muscles. Then we have the diaphragm. So the diaphragm is internally. So it's what separates the thoracic cavity and the abdominal cavity. So it's a dome-like shape. So on inspiration, what the diaphragm will do is it'll contract, and it'll allow more space for the lungs to expand. And then on exhalation, it relaxes and then creates that dome shape again and helps to exhale that air. All right, and then we have the epaxial muscles. So they're the muscles of the vertebrae. So it's actually a group of 3 muscles that are kind of all braided together. So they are the iliocostalis, the spinalis dorsi, and the longissimus dorsi as well. So they are they're dorsal to the transverse processes of the lumbar region. And so what they do is they help to extend the vertebral column, but then also help to do lateral movements. So when one side contracts, then the other side will move. So that allows for side-to-side movement of the body. And that is everything. So thank you for watching.